thank you Policy Circle for having this very, very important meeting on lung diseases in post-COVID era. Let me tell you about the two important documents which you, as you know, my dear students, my colleague, senior colleague Dr. Pandav is here, Dr. Parna is here, and all of you are here. So, before COVID came, we had conducted, there was lot of pollution in Delhi, and Delhi government came out with that odd even scheme, right? And during that odd even scheme, we conducted a study on, lung function status of adults in Delhi. And we did this study in 11 sites of Delhi, and we found that both obstructive and restrictive lung diseases were common in 36% of the population. It was not only, the pollution which was the cause. The tobacco was one of the important things which was responsible for the disease. Indoor air pollution was important part. And another important part was also second-hand smoke, for which also we have just got out a paper. It has been published. So please have a look at all these documents. This is one of the very important documents which is serving as, it's a published document. So all youngsters can quote this when you are conducting a research. And it has been there, and it has got an ISBN number, and those of you who want, you can contact me. The second part is that we also brought out, because I am a member of Swasth Bharat India Task Force, so under this Swasth Bharat Task Force with Dr. Randeep Guleria, myself, and people from across the country, we came out with a white paper on what are the post-infectious what post-COVID infectious diseases, right? So that is where we need to look at that white paper also. So we are dealing with the diseases in children, we are dealing with diseases in adults, and now we are talking of, when we are talking of, post-COVID lung diseases, that becomes very, very important also. Another thing is that recently, all of you have heard about G20 summit. What is that health component of the G20 talked about? It talked about, resilient systems, it talked about equitable systems, it talked about sustainable health, and it talked about inclusive healthcare. That is one thing which we have to remember, and that holds true overall. I was just talking to Mr. Nair before coming that why didn't we have a meeting on health system strengthening with regard to that, because so that it will involve talking on leadership and governance with regard to lung health, it will involve capacity building, it will help us in divert more finances, it will also help us in managing health management information system, and so on and so forth, building based on the 6 building blocks of WHO. All of us have talked about that when we are talking of lungs, and when we are talking of respiratory diseases, and we are talking of tobacco now, primarily what you have to remember is that respiratory diseases, we talked about in this conference about one world, one health, one future, right? All of you are aware of this part. So when we talked of one health, we also are aware of that respiratory diseases, they are affecting people in all geographies, right? But they are affecting them disproportionately. When we talk about all this, they are affecting them disproportionately because they are more common in low middle income countries and in poor economies. So there is lot of inequitability with regard to this. So important part is that when we talk about this, we need to focus on this inequity and inequality. That is important because we are just now, everybody is talking about 5 diseases when we talked about, chronic obstructive pulmonary disease. And please remember when we had this non-communicable disease program, COPD was the later to be introduced. It was not in the first phase. We talked about cardiovascular diseases, diabetes, hypertension, stroke, cancers and all that. So subsequently we added COPDs. Now we are talking of NP-NCD, program which is there as part of our, one of the task forces in health and wellness centers. The second important part which we all know is asthmas, and particularly when we talk of childhood asthmas. If you talk to any pediatrician, what are the, majority of cases they will be seeing, it's the asthmas, they all will point out, and it's a challenge, basically how to manage asthmas in children. Though substantial number of cases, they come down by the age of, they subside by the age of 6 years, but unless we control the other factors, like when we are talking of second-hand smoke, when we are talking of indoor pollution or outdoor pollution, or when we are talking of vehicular pollution as well, which is an important component of that. So that is where that bogs every parent. that my child is asthmatic, and that's where, the frequent number of visits to the pediatricians are there. And the third part which you said, that, when we talked about the cancers, across all geographies in the world now, we are talking about that there are 2 million new cases of lung cancers, which are responsible for 1 in 4 cases of cancer deaths. So that is another important part which you have to remember with regard to lung cancer. And then also we have to see that when we talk of lower respiratory tract infections, and particularly when we talk of pneumonias, it is one of the leading causes of mortality, which is responsible for 2.4 million deaths across, and which is substantial number of them. Majority of the cases come from countries like India, because we are a big country, though we have got important strategies like integrated management of neonatal and childhood illnesses and all that, but idea is to, kind of implement them in right kind of spirit. And in children, particularly when we talk of less than 5 years, pneumonia is one of the single leading causes of death. That is important. And all of you talked about TB. Let me tell you, and also, we just heard, Chavi talking about involvement of private sector. But if you talk of elimination of TB by the year 2025, any answers to will you be able to achieve that target, or will you not be able to achieve that target from this room? And why not? As of now, how many districts are TB free? As of now, we have got only 3 districts which are TB free, and we are talking of 2025. So that's where it becomes very, very important, to look at whether, we are doing with the help of private sector, whether we are doing with the help of, government sector. But the most important part is that you empower the communities at the district level. Empower the healthcare providers, strengthen the healthcare systems. We can make early diagnosis and treatment, though as per sustainable development goals, we were to do by 2030, but our Prime Minister's call was to do it by 2025. So Indian Association of Preventive and Social Medicine, through its own, network, we are involving all the medical colleges, where they are categorizing the district into, silver, bronze and the gold district. So that is where, so gold district means we are free of this thing. So far only 3 districts are the ones where we have achieved the target. So we need to be very, very pushy, we need to be very fast, and we need to strengthen the healthcare system. But nothing will come true and see the light of the day unless we empower our people. And that is where we need to ensure lung health to, the governments, to healthcare workers, to researchers, and basically to focus on, that important part is, as I have been talking since the beginning, that we need to reduce on the inequalities part. As far as when we talk about, that post-COVID diseases, one of the important causes of, post-COVID diseases, lung burden, is also tobacco. And we have listened to about harm reduction strategies and all, but let me tell you, no harm reduction strategy works till the individual is convinced. And we have come out with a lot of innovations. Few days back, I was in a meeting of I Can Care, where, a lot of oncologists and all, with the help of tobacco marshals, with the help of, cessation clinics, they are trying to attempt that the person comes to term with a behavior change. That is important. And, Maulana Azad was declared as a regional counseling center in 1996 for, HIV AIDS, when, Chavi made a mention of this. And this is where art and skill of counseling becomes very, very important. So, and that is where we must give a big hand to Government of India for coming fast with the, gazette. And Madam Preeti Sudan was there at that point of time, who was Health Secretary. And let's give a big hand for our government. A lot of initiatives are being done at that point of time. The second part is also that we all know that tobacco is an important cause of preventable deaths, right? And we GAT survey has already shown that basically we have got 267 million adults, basically, and we are talking about, in terms of who are, 28.67% of all adults who are indulged in tobacco smoking. That is important part which you have to remember. And youth survey with regard to tobacco shows that our 8.5% of the students, which are, between 13 to 15 years of age, they are consuming tobacco in different forms. So that means, almost 5,500 children are initiating tobacco use every year. So but one thing which you have to remember, that we have a framework of Convention of Tobacco Control. which has to be, kind of implemented in true spirit. And when I think any school you go to, just, in recent days, there is going to be a meeting on this toffee guidelines, that is tobacco free educational institutions. And but you have to, as youngsters, and I must, also appreciate National Institute of Health and Family Welfare and Maulana Azad Medical College for deputing these youngsters, who come here to listen to these important deliberations, so that, when you take this small problem based learning in your own institution, you'll find that, there is no institution where just within 100 yards there is no shop which is selling tobacco. The second important part is the sales to minors by minors is also happening. That is important thing which you have to remember. The important part is that I was a part of this ESTA study, that is addressing smokeless tobacco in Asia, which was involving 3 countries, India, Bangladesh, Pakistan, and 8 universities of UK. And this study just saw the light of the day a few days back. So important part is that we need to see that whether, and quite a number of students, when we ask them that why now, smoke tobacco is gone, what is important part is you see more of smokeless tobacco. And, we ask the students, and particularly as young as 7 to 8 years, we are talking of, right from class 5th onwards. And we asked them that why do you start, the smokeless? So they said we have seen our teachers doing that. So that's where we all have to be role models when we talk about this. And when we talked about, and we must have programs like something like when Chavi, when you mentioned about universities, talking about AIDS, and we had a program, University Talks AIDS. So we must have a program, Universities Talk Tobacco, because though AIDS there is a gazette notification with regard to ends, but the second important part is also that we know that it is available. And lot of our university students, they indulge in vaping as well. It is no more a harm reduction strategies, because we have seen that, and also it was pointed out by Dr. Peter that, people do have a mixed kind of, behavior. So we need to focus on that. So ultimately, with regard to both the issues, when we talk of lung health, when we talk of TB, and, associated tobacco, primarily, we need to focus on this, for which we require health system strengthening, and that is the need of the hour. And second part is we need to focus on the climate change as well. Thank you very much.